All right, so we have Dr. Lisa Piercey, our state's top health official. And before I start talking about case totals and surge capacity, I just want to ask you generally, how would you say we're doing as a state and as a country right now in this phase of the pandemic?
So thanks for having me today. You know, to answer your question, I think that is determined by what is our measure of success. Because if you just look at case counts are going up. And so, if you want to use that as a metric, it's probably just like everybody else. But for the governor and me and our team, we've decided that the ultimate metric here, and I would challenge anybody to argue with this, is how many Tennesseans are we ultimately going to lose? Everything we do is to prevent and reduce the number of deaths and also hospitalizations, but ultimately deaths. And quite frankly, we're one of the best in the nation in that. We've had about plus or minus 550 deaths total. And when you look at that per capita based on all of the others, compared to all of the other states, we're in the bottom 5 or 6 of states. That's where you want to be in death rate. And the states that are below us are very sparsely populated states, Montana, Wyoming, that kind of thing. So, we're doing well as far as outcomes. Cases are going up, but that doesn't tell the whole picture.
That doesn't tell the whole picture. Well, some of those specifics, we're speaking Thursday morning. Latest numbers show an uptick, one-day uptick of 932 cases, more than 5,000 new cases in 1 week. I was going to ask whether you were concerned by that, and more specifically, are we running a risk of exceeding our hospitals' surge capacities?
Those are the right questions, and I appreciate you asking it in that way. So when we look at cases, what we want to look at is what is our overall positivity rate and how are we doing on case count versus number of tests? Because if you watch the numbers on a daily basis, sometimes you will see these wide variations, and both in case count and in testing. So we're starting to take a more weekly approach and take a step back and say, okay, what is this on the whole? And you're exactly right. On the whole, case numbers are going up. But what is not going up at the same rate are hospitalizations. Now, yes, we do have more hospitalizations now than we've ever had, but let me put that into context for you. As of yesterday or a couple of days ago, the last time we ran the numbers, COVID patients in hospitals statewide only account for 4.9% of all hospitalizations. So if you just take it on the surface of hospitalizations are the highest they've ever been, that's true, but you have to keep that in context. So now I will tell you in full transparency, that varies by market. And so the Memphis Shelby market is kind of the hardest hit for hospitalizations. And their numbers are a little bit higher. It's closer to maybe 9% of hospitalizations in Memphis. Now, 9% is not going to stretch any hospital's capacity. But what you have to remember are there are lots of other people in the hospital with other conditions, summertime trauma, heart attack, stroke, the normal things. And then our biggest concern is probably come on into the fall, September, October, November, when occupancy rates at hospitals are normally pretty high, even without COVID. If we have a bad flu season, and I don't know how to predict that, if we are or we're not, if we have a bad flu season and then you put the COVID hospitalizations on top of that, then we could start running into hospital capacity issues. So we've tried to make several preparations throughout the last few months to not only sort of treat that in place at hospitals inside their own walls, but to offer alternatives in the disastrous event that they can't do that.
So, Commissioner, sounds like you're saying right now, not particularly worried about surge capacity, but when we enter flu season, we'll just have to see.
That's right. And so, as people start to resume elective procedures, as people start seeking care appropriately, and I'll take a sidestep and tell you that that's been a concerning trend that we've seen and nationally. People haven't been presenting for care for heart attacks and stroke and even cancer diagnoses. And so that may be a combination of being frightened to go out into that setting or just not having as many symptoms or recognizing the symptoms. So resumption of elective procedures, people seeking appropriate care, and then anything else that may stress the healthcare system has to be considered. And so we have to have our plans in place. I feel very blessed that we work in a state with incredibly sophisticated and highly professional hospital organizations. And so they have robust surge plans within their own walls that they can really scale up. And they've had to do this during flu season sometimes. And so I feel pretty confident at the capacity that they're able to leverage when they need to.
And Dr. Piercey, here locally, we're seeing upticks in Knox County, Hamblin County, Sevier County, a couple others, but those three specifically. We hear time and time again, as we reopen, these numbers were not unexpected, or these increasing cases were not unexpected. Where we are now, were you guys projecting this, the increase we're seeing throughout the state?
So we did. We knew that as people would move about, that they would come in contact with more people and that infections would go up. This is how any infectious disease works. And so we're trying to really balance the two tensions of economic recovery and getting businesses and individuals back on their feet economically, because you absolutely cannot separate individual economic prosperity and health. There is a well-established link between the two. And so, but balancing that with health concerns, everybody knows that we can't stay shut down forever. So that creates an impetus for us to, how can we coexist with this? Because until we get herd immunity or a vaccine, we're going to be dealing with this virus. And it was never the point to minimize or eliminate number of cases, because that's not a feasible goal. What we've always tried to do, and I take the opportunity to remind folks at every turn, is flattening the curve is about preserving health system capacity. If cases go down, that's great. We have the ability to preserve the healthcare capacity even more, but this virus is going to be here. So the increase as people move about more is not unexpected.
You know, in Knox County, our local health department credited this week people not following those 5 core actions, wearing a face covering, keeping that distance, and that sort of thing. You know, we're seeing in Wilson County a mandate for masks. We're seeing in the city of Memphis a mask mandate. We're seeing for the entire state of North Carolina a mandate. I'm just curious, will we see measures like this statewide in our future?
So that's certainly a hot topic these days. And it's our stance in this administration that, you know, really every decision lies at the individual level for personal responsibility. And we want to make sure that people know that there are a lot of different things they can do. Face coverings are incredibly effective. Hand washing is incredibly effective. But you know what else is really effective? Not putting yourselves in situations where you're in close proximity to one another. And so while we want to allow those freedoms, just as I tell my teenagers sometimes, just because you can doesn't mean you should. And so just because you can go to these events and gatherings, you may want to think, do I really need to do that? Or if I do want to or need to do that, how can I do it in the safest manner possible? Wearing masks when you're out, washing your hands, staying away if you're sick, all of those techniques are important.
One of the areas here in East Tennessee and really around the state that's unique is Sevier County. They were recognized by the New York Times as having the 4th highest average daily growth rate in cases. I spoke to a lot of local leaders there, and many of them say they don't have specific information about maybe where the cases, if they're in one spot over another, or if there's anything they can do to help encourage visitors or locals to stop the spread or slow the spread. I'm just curious, should there be more collaboration between the state and local officials?
I mean, that's a fair question. I would submit that there's already quite a bit of collaboration there. We're in contact with our partners in Sevier County, who, by the way, are our own employees. Those are state employees at the health department there, and then with local community leaders on how to target hotspots even within a particular county or region. Part of that is we try very hard to protect patient privacy. And this has been a really fascinating and, it's cliche now, unprecedented time, at least from a medical standpoint, because we've never really, healthcare entity, been able or willing to share this much information, because it does cross the line into patient privacy sometimes. And at the very core of all of us in the medical profession, we are patient advocates and we want to maintain their privacy. However, you have to do that in the context of public safety. And so that's a delicate balance of balancing those two. But I would also take this opportunity to remind you that once you have a hotspot, it's too late then. I mean, we can make all the measure, we can enact all the measures that we want, but that means people have already gotten infected. And so we can reduce further spread. But when we start seeing that, we really need to double down on our efforts to prevent infections in the first place. And so targeting specific areas is sort of like chasing your tail sometimes, because they're already breeding infection there. And so we want to mitigate further spread, but prevent it in the first place.
That makes a lot of sense. I appreciate you explaining it that way. But this sort of leads me to my next question about contact tracing, and where we are in terms of, do we have enough? We're hearing about people learning of exposures maybe in their workplace, but they were never notified through a contact tracer. We had a viewer suspected the problem was because his coworker lived across county lines from where he lives. He actually took it upon himself to call his own county health department and notify them about that neighboring county case. It seems he would have never known any other way. Is that something you're running into with the metro areas and living outside the county?
I haven't heard as many issues about county lines, but I think there may be another factor in the anecdote you just shared that is likely playing a factor here that a lot of people have difficulty understanding. So there's the index case, and there is a full investigation of all of those. Sometimes those initial calls can take 30 minutes or an hour, helping folks walk back through what they've done over the last several days, who they may have come in contact with. Because I bet if you and I tried to sit down and even make a list of everyone we came into contact with just yesterday, that would be very difficult. And so those initial case investigations take some amount of time. And then people who are identified as close contacts in that process are the ones who are contacted. I'll take a minute to remind you of the definition of close contact, which is, generally speaking, less than 6 feet for 10 minutes or more. So if you have someone in a workplace that you may have passed by their desk a couple of times a day, but really didn't stop to talk, you weren't in a conference room with them, you didn't have lunch with them, they wouldn't necessarily be considered a contact. And so a lot of people hear about a case within their church or within their workplace, but not actually considered a contact, and so they wouldn't qualify to be through contact tracing.
So oftentimes I suspect it's not a lack of resources, it's just they don't meet the criteria to receive the phone call.
That's right. That's right. And also, you know, there's still a lot of fear and a lot of misunderstanding. And while human to human spread is the most common way, it's not just in casual contact. And so a lot of people get concerned about level of exposure, but a lot of times they're not really at as high risk as they think they are.
And Commissioner, I'm running out of questions, I promise. Is there a next phase or a next step in the Tennessee Pledge? We asked because Knox County is getting ready to jump to the Tennessee Pledge guidelines rather than their own phase 3. So from your perspective, what's working with the pledge, what needs improving, and again, is there a next phase?
So I think the thing that's working the best are model businesses. And, you can see it when you go into a place. They're taking very specific steps and extra precautions. And in those instances, it's working very well. And not only are they keeping their customers safe, but they're modeling good behavior for other businesses to say, hey, we can reopen and we can do it safely. It looks and feels a little bit different than it did before, but it's totally tenable and we can handle this. That part of the pledge is working very well. And I encourage folks when they see businesses to brag on them, because I guarantee you the staff, is having to work harder, and the management is having to think about it more and make extra precautions and perhaps spend extra money. And so we want to patronize those businesses. I just read about a restaurant earlier this week who every 30 minutes they play a certain artist song, and that's kind of the auditory cue to the staff. The customers think it's just a normal music playlist, but the staff recognizes that song and they take measures to wipe things down. I thought that was incredibly inventive, and so I had dinner there on Tuesday night. And
I was gonna,
so yeah, those are the kind of things that we're trying to balance that tension, and the Tennessee Pledge is a great way to do it. I'm proud of you guys for adopting that.
I was gonna say, if that's an East Tennessee restaurant, let me know. I want to go do a story today on that.
Yeah.
Lastly, Commissioner, again, thank you. It's not every day that we get a second to speak with our top health official one-on-one. My last thought is really just opening the floor to you to speak to those. Specifically, we have a lot of parents of school-age children who are going through a lot in terms of returning to school in the fall. But in general, you just have a little bit of anxiety among some in our viewing area. So before we go, what would be your message to Tennesseans on our end of the state?
Yeah, that's a great question, and I completely empathize with that. I have 4 children of my own, and my oldest will be starting college this year, and then the other 3 are in high school. And so as a parent, I have these same concerns. I'm thinking about this same thing, particularly as the new school year comes into play. I've spent a lot of time with Commissioner Schwinn in the Department of Education. We're working very collaboratively to make it the most safe environment for our children and for our faculty and staff, because some of our teachers are at higher risk based on their health conditions or perhaps their age. And so we wanted to be a conducive learning environment, but also a safe and healthy environment. And so I would encourage everyone to listen and provide some grace to your district leaders. Just like many of us, these school leaders never thought they would have to make the kinds of decisions or being in these kinds of situations. And so we're all doing the very best that we can. Have a little grace, have a little patience, and we'll get through this just fine.